One of the most important data sets looking at the outcomes for people who faced COVID-19 after being vaccinated is possibly going to be destroyed. It was only managed to be held up because of public outcry in Australia. This data is so important to understand the implications of exposing a large population to COVID vaccines prior to them being exposed to the virus. Why would it be destroyed? Now, you have to understand where I'm coming from. And this post, an article that I did recently, the link is in the description, was highlighting the fact that it seemed from the data that those who were vaccinated could have been at higher risk for negative outcomes after reinfection. And even when I did this simple poll, it was removed for misinformation just for asking the question. And when you looked at the paper, as I have down here, the link is in the description if you want to see the full article, looking at all-cause mortality, comparing the unvaccinated, one vaccination, two or more vaccinations, and it seemed to suggest that the higher risk was in those who were jabbed. This question is an important question. It was one of the few times that I found some data that was trying to answer an important question about reinfections and exposure. And this case, it was after severe COVID. So that question in relation to that was simply, if somebody already had severe COVID, what were the outcomes if they were subsequently vaccinated? That's all I asked. And it caused all kinds of problems. So you can understand why my content keeps on getting suppressed. What can I do? Anyway, let's get back to this important question about what exactly is this QoVAX and why is it so important? Essentially, what they were looking at in Australia and Queensland, this was a study looking at COVID vaccination safety and efficacy, trial pilot study in adults aged over 18 years. And this was set up primarily to study the characteristics between healthy vaccine recipients and those who have autoimmune or immune suppression. So they were looking at multiple points, comparing what happened to the immune system after this population was vaccinated. Huge piece of research. I mean, I can't express how important that kind of data is. I mean, the only thing that would make it better is autopsies, but nobody wants to do autopsies these days. Here is what they said in 2022. So this is in April of 2022. And what I'll try and see if I can make this a little bit bigger for you here. And so essentially what they said is that statewide study aiming to improve the understanding of short, medium, and long term. We're not even in long term yet. We're still only in medium term. Impacts and effects of COVID-19 and COVID vaccines in this state. It was absolutely innovative. And it was led by Professor Janet Davis. Really, really important outcome to track short and long-term vaccination experiences and outcomes. It will build our understanding of how and why our immune systems responded differently to COVID-19 vaccines, genetic makeups, lifestyle, all kinds of things. This was breakthrough science. And so you would think to yourself, what in the world would make them bin this kind of research? I've got here from the Spectator in Australia. And so this is an article that you'd have to pay for. So you can see that there is a paid for element to it. But the main point is here, they have highlighted the killing of QoVAX, the mRNA data set for destruction. And this article was written in May of 2022, May 2025, sorry. And so it was highlighting that this important study, the scope was extraordinary. 10,000 adult Queenslanders were recruited from 86 of the postcodes. They had over 100,000 biospecimens were collected, generating more than 11 million data points. This was huge. It was breakthrough. It was the kind of research that we would want to have done. And this is especially important now as there are questions about what is going on. They're now up to, I don't know what number booster they're at now, but what are the impacts on health? We've never done this before with any other disease. So if we're giving 10, 12, 15, I mean, at the moment in Taiwan, it's 2 monthly boosters. So that's easily 6 a year. So if you imagine if we extrapolate that to, say, Australia, if they got to even 4 a year, what are the impacts in terms of mortality, in terms of the immune system response, in terms of cytokines? There are just so many questions that you would be able to track and understand. But this was so serious that at this point here, this is from the Queensland Parliament, immediately halt the destruction of data, biospecimens, and preliminary reports as part of the QoVAX research program. They had informed all the people involved that this was no longer valid and they were going to not just scrap the research, they were going to destroy all of the specimens. And so this had to be a petition to go in looking at protecting this data set as part of a major national and international significance. It was defunded for 20 million, which was looking at examining COVID-19 impacts over 100,000 biospecimens. And they considered that destruction of this data set and biospecimens is arguably unlawful under the Criminal Code Act because it's equivalent to destroying evidence or potential evidence relevant to judicial proceedings. This is how serious the public outcry was. They had to go to court or legislation to stop them destroying the data that would, in theory, prove just how safe the vaccines were. Why would you destroy that data? For all the people who are out there criticizing, say, the people who are concerned about the elephant in the room and talking about this and that, the best way to silence someone like myself who has concerns is to just use that kind of data. Why would you destroy it? I mean, it's incredible, inconceivable almost that that kind of data would be destroyed. Why? Why at this point would they need to destroy it? Their explanation, I think, and this was in the Spectator, I'm trying to find where they said it, because they went on to send a message out to the people who had been involved in it. And essentially, they were saying that it no longer is relevant because of different variants, and it's no longer useful. And so they're going to destroy it because there is no value to it. And to be frank, even if there is some cost to storing specimens. So it's not as if storing specimens are free, but to destroy it, that kind of data, do you know how valuable something like that could be in 10 years' time? If you found something that was relevant, you could go back to the data and you could say, oh, look, here are the signals. As far as I'm concerned, the only reason somebody would want to destroy that is because of concerns about liability, not about science. In science, you want to keep as much data as you can to study things as long as you can. That's usually the hard part. But to destroy the data, unbelievable, outrageous. And I hope the public in Australia are able to stand up for this. This is critical information. As I said, the even more valuable information is autopsy data. But if you can see they're going to be destroying blood samples, because they don't want people to look at that kind of evidence. It is no surprise that my autopsies that I've been calling for years are still not being done. It was in January of 2023 that the first full autopsy on somebody who was vaccinated and died of COVID was done. That was the first one. Since then, there are a few scraps around, but nobody is interested in looking at pathology and histology of people who are vaccinated who died with COVID or even otherwise. Only the Japanese. And every time they look, they find something more worrying. The last one was the multiple microscars in the heart, something we've never seen before. And their interpretation was that this was possibly related to boosting. I mean, no wonder nobody wants to do autopsies. No wonder all of the specimens are set to be destroyed, because the implications are so serious. I have no idea where this is going to end up. All I know is this: if there is no determination to understand what is happening in the context of what I've described about the COVID storm, where you have a highly vaccinated population who is getting reinfection after reinfection, what are the health outcomes for that? I don't think anybody had that in their plan in 2021. At that time, you were told that this was supposed to stop infection. And then even when there was a realization that, okay, it doesn't quite stop infection, there seems to be no concern about the impact of reinfection. What is happening to the immune system? My view, spike protein, if you don't want to say autoimmunity, the immune responses to spike protein are very, very significant. And we need to understand the implications to the populations across the world. Hopefully, in Australia, they can keep that data because it's relevant to all of us. Have a great evening.